All right, so what you'll do is over the open areas, we put the zero form gauze, okay, right on top of the open areas, okay? You wanna make sure that we don't get it over too much of the stuff that's already healed, because we want that to stay clean and dry, okay? And then we'll put a little barrier, and the purpose of these 2x2 gauze is to help if anything drains out, right? So, then roll gauze on top. Okay, and then come up. It doesn't need to be as fancy as I make it, okay?
Okay.
As long as you have the dressing stuck to the finger, I'm fine with that, all right? So if you need to do it in 2 pieces, that's okay. Just make sure that you get it all covered and onto. All right. If you notice that if it bleeds through, then I'd prefer that you did your dressing changes sooner than waiting till the next day, especially if it happens early on. All right. So we're gonna go over the passive range of motion exercises next. All right, and if you could do this with yourself, or if you want your helper here to help you, then that can happen too.
Okay.
The first exercise is MP range of motion. So what you're doing is you're basically taking and you're bending at that knuckle right there, okay?
Okay.
I want you to go till you feel a stretch or gentle pain, okay? I don't want you to be like, oh, it hurts right here, and then like go further. Obviously in therapy, we're gonna go probably further than you will at home, but that's because for us it's a feeling, and for you, I want you to go with like a pain level or a discomfort rating, like at about a 2, okay? So I'm doing this one now where we're bending at just this joint here, okay, as far as you can. You can feel that, it feels uncomfortable. These are the harder ones, okay? So now we're gonna bend at this joint and this joint. This is called the PIP joint, and this is called the DIP joint, all right? So we're gonna bend those simultaneously, like so, okay? And what you're doing is you're forcing yourself to make like a hook grip, like that, okay? Next one, we come straight, and you notice each time I have you come back straight, because the purpose of the surgery was to do the extension part, so we wanna make sure we don't avoid that. Next, we're gonna do the MP, PIP, and DIP, which is all 3 joints at the same time as if you were to make a full fist, right? So back here, here, and here. That one got you smiling, right? So then you're just gonna go nice and easy, hold it for a 10 to 15 second count. You can do up to 20 to 30.
Okay.
Okay, I don't like going too long because, you know, you don't want to put yourself in a bunch of pain for that long.
Yeah.
Especially in the beginning. Okay, and then again, back to full extension, which are what these 2 bottom exercises are. So I'll do these and then go right and do those in combination, so it kind of saves you some time in doing your exercise. Okay? Next, active range of motion. So the passive is where we're pushing. Active is where you're actually getting the tendon activating, the nerve is firing, okay? So the first one is you're gonna just make a big fist, best that you can, stretch or gentle pain, hold it. And these I like to do for less shorter hold. So like 1/1002 and then come all the way straight, just like that, okay? Next one's the flat fist, okay? So you're keeping those, perfect, all the way down, bend at those 2, hold. Don't expect it to be perfect on the first day, so just take it easy, let pain be your guide. And straighten, okay? Next one, hook grip, all right?
How's that feeling?
Good, perfect, and hold. And you can see you're kind of stiff in those joints anyway, so don't expect this one to be perfect right off the bat. This one, fingers wide as you can. Hold, 1/1002, back together. You're gonna be doing them more frequently, repetitions wise. So these ones you'll do shorter, you'll do 2 to 3 seconds, but 10 repetitions more frequently throughout the day. With the passive, we're gonna do longer holds, prolonged holds, okay, but less reps. All right. These last ones are blocking. So what we're gonna do is you'll hold here, and then you're just gonna bend the tip far as you can. Good. And then straighten. And you can see I like putting a little bit of back pressure on that because you feel how you can get some leverage and it makes it feel like you go straighter.
Right.
And then this one here, bending the tip far as you can and hold, and then straighten. And again, there's my back pressure.
Okay.
So she can help with that as well.
Yeah.
Okay, questions about that at all?
No.